Hi, my name is Dr. Tony Salame. I'm a doctor of chiropractic, and I have an office here in Panama City, Florida, in dealing with chronic health conditions such as fibromyalgia, chronic fatigue, migraine headaches, autoimmune disorders, chronic pain, and a whole host of other chronic health problems. I also hold a master's degree in clinical nutrition, and I have several postgraduate hours in functional neurology, blood chemistry, and endocrinology. Over the years, I realized that many people like you have been greatly underserved when it comes to finding the underlying cause of your health problem. Some of you have been to 5, 10 doctors and even more, and are not getting the answers, or haven't been listened to, or haven't been thoroughly tested for. And conventional medicine, they're great when it comes to emergency care. They're very good when it comes to blunt force trauma, heart attack, stroke. But when it comes to chronic care, they're just lost in a lost world. They treat chronic health problems with acute care, and it just doesn't work. Well, I'm here to tell you that there is an answer to your health problem. And the only answer comes when you find out what's actually causing it. I'm sure you've heard the saying, nothing ever really goes away until you find out what's causing it. Until you remove the cause, it always comes back. And our focus here at our clinic is to figure out what's causing your health problem. And the way we do this is we use cutting-edge methodology and scientific protocols in order to find out what's causing your problem non-invasively and with natural means. Today we're going to touch on the condition called fibromyalgia. Now, if you have fibromyalgia, you know what that means, which is pain, diffused pain all around the body, in the joints, in your muscles, and in your tissues. And with fibromyalgia, many patients that we see that have fibromyalgia are under pain medications. Some of them are very dangerous, like narcotic pain medications like tramadol, that are addictive. Some fibromyalgia patients are on Lyrica, which is actually an anti-seizure medication that really doesn't do anything to actually treat the actual problem. Others also, you might be put on Prozac or Zoloft or Cymbalta, which have serious side effects with the antidepressants and anti-anxiety medications. And a lot of people with fibromyalgia have problems with fatigue. In addition to the pain that they have, they're constantly fatigued. It's hard for them to get out of bed. They wake up in the morning. They're slow starters. In the midday, they may have a midday crash. A lot of them have immune problems as well as hormonal problems, and are problems with staying asleep as well. They can't get to sleep, and some of them have problems staying asleep. And with fibromyalgia, others have also may experience weight problems, may experience also blood sugar problems as well. I want you to know that we understand that fibromyalgia is real. Today I'm going to talk to you about the causes of fibromyalgia and the treatment methods that we use in order to treat you with the fibromyalgia. Now, in fibromyalgia, the mechanism is very similar in each patient. However, the causes and the triggers are different. Now, this all starts with the brain. In the brainstem, there are three major areas. You've got the medulla, you've got the pons, and you've got the midbrain, or what's called as the mesencephalon. The brainstem is the most vital area in our bodies. All our major neurological pathways go up and down the area, communicating with the rest of the body. Normally, the lower part is supposed to inhibit or slow down the upper part. But in fibromyalgia, they lose that functional feedback, where the lower part is not doing the job of inhibiting the upper part of the brainstem, which the mesencephalon. And what happens is there are aberrant signals, or signals that hyperactivity of the tracts that go downwards to the rest of the spine and create the nerves to be hyperactive, especially the area where the nerves are feeding out to the adrenal glands. What happens is the body is releasing what we call as catecholamines, which are your adrenaline hormones or your stress hormones, and they're mainly epinephrine or norepinephrine, which causes high blood pressure, speeds up the heart rate, it can cause excess sweating, it can cause problems with sleep, it can cause problems with high blood pressure, blood sugar metabolism problems, and more importantly, it causes pain fibers to be sensitized. They're primarily your C-type fiber pain. And when that causes that sensitivity, many fibromyalgia patients have that sensitivity to the touch. Medically, we call it allodynia, and that is the sensitivity that these fibromyalgia patients have. And even we find fibromyalgia patients actually in pain just by wearing their own shirt or pants. They feel that they're, in pain because, their nerves are always sensitized. So that's what we find with fibromyalgia is the main point is that the lower part of the brainstem is not inhibiting or slowing down the upper, and that's going out of control. So there's a reason why this happens. And the reason why this occurs is different, and it varies depending on each individual that has fibromyalgia. For instance, some fibromyalgia patients have food sensitivity. Some fibromyalgia patients have chronic infections, heavy metals. A lot of them have a mixture of both, of all. So what we need to do in order to assess the cause of fibromyalgia and treat this debilitating condition is we need to actually look and find out what is actually triggering it. What we do is once we find those triggers and we remove those triggers, then we need to be able to restore the function and rewire the nervous system. If this is something that you're serious about, it's something that you want to get well, then I'm serious about working with you. And I want to personally invite you into my office for a consultation. There will be no charge for that. I'll take a look at your file, take a look at all your medical records, all your diagnostics, your lab work. I'll sit down with you, go through your history, and I'll see what we can do for you. I'll tell you basically if I can help you. Now, if this interests you and this is something that you're serious about, then I encourage you to give us a call. You can also fill out your information and get your email address. We'll also, somebody from my staff will be in contact with you shortly to set up your appointment. And I want to personally thank you for watching this video. I'm Dr. Tony Salome, and have a great day.